So I started life off as a diagnostic radiographer. I trained in central London back in 2009 and then graduated in 2012 and worked for 3 or 4 years. First of all, as a general diagnostic radiographer and then specializing in cardiac radiography. And I worked in a cardiothoracic center in Essex where my consultants suggested that I retrain in medicine. Initially, we had, everyone has a debate of medical school, and recently a local hospital was opening up a PA school, and so I was debating between medical school and PA school, and actually I decided to train in PA school. It was part of the first cohort of PA to train in Essex, and then since then I've been non-stop PAing, which has been fantastic.
So my journey into being a PA is that I initially done my undergraduate degree in 2004 and graduated in 2005. I did human biology up in the University of Huddersfield. I then worked in junior management roles until 2012. I realised I wanted to do something a bit more patient facing. So we employed a PA in Northampton Hospital, and I realised that I wanted to actually do something like that, and I didn't want to do medicine. So I enrolled in the physician associate program in St George's in 2012. I qualified in 2014, and I've been working in urology in St George's Hospital ever since. I was thinking about this long and hard about whether anything has surprised me at all. And I think, in all honesty, no. I think when I knew that I wanted to be a PA, we had a really good introduction by our course director, and I knew that sky was the limit. And I've seen a lot of PAs taking on extra procedures, so from doing muscle biopsies and leading teams. So I did know that PAs would be taking on extra responsibilities from an earlier point in their career. So I don't think for me anything was a surprise, and I've seen PAs kind of excel in their kind of career. So no, not really.
For me, one of the biggest surprises has been how actually welcoming the majority of doctors, nurses, and teams are. So you can often see a lot of negativity, and sometimes you're greeted with negativity when you first go to a department or a new specialty. But actually, for me, over the last 5 years practicing as a PA, I just have nothing but overwhelming support for my role. Other teams have got used to me and get to know me. And actually, for me, that's been a surprise because I think a lot of people are concerned when they're entering the profession. They see lots of negative things toward PAs, but actually, the vast majority of people are just thankful to have you there. They're really happy when you're on the team. They like your input. They value you as a team member, and that's been really useful and very reassuring for me actually. For me, some of the career highlights so far have been the increasing independence that I've got within my department. So when I first started in hematology, it was a fairly new specialty to employ PAs. There weren't many around the country. I was the first PA in hematology in our department, so it was all very new. And as you well know, hematology is not a vast amount of teaching in our PA program, so it was a rapid learning curve. But over the last 5 years, I've really gained my independence. I now run outpatient clinics where I see patients independently. I have a stable patient follow-up that I see in our clinics. And a lot of our patients, get admitted for chemotherapy and go home, come back in for another cycle of chemotherapy, and I'm often the first person to see them, and I see them for their treatment plan. And for me, that's been one of the greatest highlights is that I get to see them from start to finish, and the consultants trust my opinion. They trust that when someone's getting chemotherapy, they're fit for it or not, etc. So that's been really, really, a highlight for me. Um, Clinically and professionally, I've taken on more responsibility. So I do bone marrow biopsies independently, which is a fairly invasive procedure. And I trusted to do that. And actually, the vast majority of the time, the registrars might come and say, "Do you mind doing this marrow? It's a bit difficult." Or the consultants may say, "We've got someone who's very specialist in it." So that's quite a nice perk. Um, Additionally, I've been heavily involved with the FPA, which has been super useful. So I was lucky enough to be elected by the membership to be on the FPA board for a couple of years. And that gave me lots of opportunity to be involved with different things like prescribing, career development frameworks. And, really the pinnacle of my career now is being newly elected as the president of the FPA, which, I'm not sure there's a more of a highlight for me in my career trajectory in the future. But, the book is yet to be written, but we'll see. This is a pretty good high for me to be at the moment.
think I've got a few different highlights in my career. I think one of them is education and seeing PA students in terms of their trajectory from being a student to being a qualified PA. And it's actually quite nice to see them working and, you know, publishing case reports in journals, and that's been so rewarding to me from seeing them from student to being qualified. I think that's been quite rewarding to see. I think other things is that I've was one of the first PAs working in neurology, and I wanted to see where my career could go. So I got in contact with a few American PAs who worked in neurology, and I went to some of the conferences earlier on in the States. So I ended up going to Florida to listen to a conference about PAs working in neurology, and I got invited back to speak at a conference in Las Vegas, which is something that I would consider a huge career highlight for me. Following on from that, I think other things that have been career highlights is, you know, performing cystoscopies independently, and also shaping the curriculum within urology itself for PAs. So there's been a number of different highlights for me.
So I guess I've been involved with the FPA board for the last couple of years and been involved with lots of projects. So, for example, helping to write the case of need for prescribing, being on the core competencies framework for MAPS, involved in conversations around indemnity and answering questions relating to scope of practice and things. And over the last, 3, 4, 5 years, I've seen lots and lots of variation in what a PA is allowed to do and what should a PA be doing and why should a PA be doing that. And often there's, lots of confusion around that, and often PAs themselves are a bit confused with what they can and can't do, and consultants are confused and trusts just don't know. So over the last couple of years, I've been advising on that. And, having experienced that myself in my own practice and hearing about other PAs, I thought, well, actually, could I try and shape our future scope of practice to make that more standardized, so that what one PA is doing in Scotland is the same as what someone in England, same as what someone in Northern Ireland is doing. And after some conversations with friends and family and colleagues, they were like, well, the presidency is there. There's an opportunity to kind of shape and mold the profession going forwards. And I was kind of on the fence initially. I was like, it's a big undertaking. We've got lots of work going on. Obviously, professionally, my career is moving forwards, and I need to focus on that. But actually, I thought we've got almost 3,000 PAs qualified now. We've got a big membership body. Everyone's got loads to contribute, and I'm hoping that I can kind of pull us all together and get us all to work together and kind of push our profession forwards. And as a radiographer, I was always the one pushing the boundary, kind of doing something that a radiographer hadn't done before, and kind of being that first person. So I thought, well, why not be the president and be the first PA to push the boundary here and push the boundary there, and why not give it a go? And somehow, through your votes, I managed to get here, and now I'm the president. And yeah, it's I've only been in the post a few weeks now. I'm still getting used to everything. Those of you that know me well will know that I'm navigating the political landscape, as well as professionally how we can move forwards. And yeah, it's been challenging so far, but actually I'm learning lots. We're kind of getting our heads together, and we're kind of developing a plan as how we can move the profession from where we are now to where we want it to be. And that's, for me, key to where we're going to go next is your involvement as members. And one of my key things is basically to try and get you guys involved as much as possible to tell us how we can get you the clinical career development you need in the future, and ultimately provide patients with the best care. So yeah, that's a bit of a waffly answer, but that's why I've ended up here and how I've ended up here. So yeah.
So I think what made me decide to run for vice president of the FPA was that I've always been passionate for our profession for a number of years. It started realistically when I was working in my third year as a PA. I realised that there wasn't a lot of educational opportunities for PAs across the UK, and I put on an event at my local hospital, which was an afternoon of teaching and CPD. So that went quite well, and it expanded over the following years, where we had a number of annual events where we taught PAs across St George's and across London. So I've always been interested in developing PAs from an educational perspective. From there, I've always been interested to know where PAs can develop in terms of nationally. And I think from going to the US and seeing how the profession works there, I feel like we've still got a long way to go, a little bit. So that's one of the reasons why I applied for the vice president, because I still feel like we've got, well, a long way to go, but we're not working to the top of our game. So I want to take PAs to the top of their game, and that's why I decided to run as the vice president.
So some of the opportunities that I've been involved with clinically is developing our outpatient hematology daycare unit. So I was involved with a structured review group that basically looked at how our outpatient unit ran, how the patients are moving through the unit, and where efficiencies could be made to try and increase and improve patient experience. That was really useful for me because it not only taught me about modeling and patient activity and how we kind of code that, how we audit that, and how do we change the way patients come through our service, but it also looked at the individual staffing models. And often we think we need more doctors, we need more nurses, we need more PAs, we need more space, but actually, in reality, that's not going to happen for the vast majority of trusts. And that gave me the opportunity to learn about how we can utilize our space better, we can utilize our staff better. Just because someone has always done that task, do they need to be doing that task, or can we have someone else doing that task? And as a PA, we are kind of the perfect model for that, because we are doing something which other people were doing before, and now we're doing it, and it's changing the way we provide care. So actually doing that on a strategic, functional, day-to-day level, how we run a unit, was actually really beneficial, and that was a good opportunity that I found useful not only for my patients, but actually my professional development. And then obviously I've been heavily involved with the FPA for a couple of years now, always lots of opportunities. So I got elected to the FPA board, which essentially there isn't a defined role. As you're on the board, you kind of get given tasks and groups and things to get on with. So some of the things I've been involved with were discussions with indemnity providers about what is a PA, what are they doing, what they're getting up to, what is their scope of practice, so we can kind of come to some kind of indemnity agreement with the provider. I've been involved with the core capabilities framework, with Health Education England, trying to develop that piece of work. Been involved with writing the case of need prescribing, what prescribing may look like for PAs in the future, and advising on those kind of things. So for me, they've been fantastic opportunities that have been kind of offered to me, and fantastic. But I've also sought opportunities for myself. So I approached the British Society for Haematology, and got involved with their education and communications committees, trying to help and advise on that, particularly bringing PAs to the knowledge of BSH, kind of educating on what a PA is and how they get involved. And on the back of that, we were involved with the BSH 60, so there were 60 years as a society, and PAs were mentioned in that and as part of the patient experience. So I think Chas summarized it. We can break down those barriers, we can push the boundaries. There are often opportunities given to us, but actually you can also seek opportunities by asking. And for me, there's been some of the things that I've been involved with and got along with, which has been interesting and difficult and time consuming, but actually it's benefited not only me and my professional development, my patients, but also the PA profession, because it brings us into a good light that we're able to contribute in that way.
In terms of additional opportunities I've been involved with as a PA, I've been involved in quite a number of opportunities. Starting off in my trust, I've been involved in a few quality improvement projects that have helped inpatient referrals. Other things I've been involved with is creating new jobs within the hospital, so new roles such as interventional radiology. I've also worked for HEE in terms of creating new posts within North Central London. I've also helped with recruiting students into student placement, so in primary care and secondary care. So I've done a wealth of different things across Health Education England and within my trust as well. In terms of, I've been working for the FPA since 2017 in terms of sitting on the quality review and question writing board. It's really a good introduction to standard setting, but also critiquing single best answer questions. I would really advise, if anybody's interested in working in education and writing questions, that they really join this group. It's a rolling group, so if anybody's interested, please do get in touch.